Uganda is hosting over 1.8 million refugees, majority from Democratic Republic of Congo and South Sudan. However, this number has faced tremendous challenges in terms of resources despite the government's effort to sustain the number. In this regard, AVSI Uganda under the SMILES project, Sustainable Market Inclusive Livelihood, rolled out an initiative to train refugees and refugee hosting communities in life sustainability courses.
We do a 50-50, 50% refugees, 50% the host community. And the reason is because they coexist. They support each other. A number of assets are borrowed from one to the other. For example, in the host community has land, and sometimes this land can also be utilized by the refugees.
According to John Makoha, the country representative at AVSI Uganda, the refugees have been relying on donor funding. However, with cuts in donor funding, the result might be severe.
The funding has been dwindling, it has been going down, and the aim of the project was meant to build families so that they can be able to survive. So what this project is attempting to do is that you can support them at the very beginning, give them skills, and after that they can be able to fend for themselves.
The project targets women, children and youth, and the project's key components are consumption support, saving, business coaching, technical skills training, among others.
Tailored multi-sectoral programs that are delivered to help people who are in extreme poverty to get out of it. To be in extreme poverty means you live below $1.90 and you have all those characteristics of poverty. And fortunately, I think globally there is lots of evidence, lots of randomized controlled trials that show that they work.
They can fend for themselves, they have acquired skills, they are able to save, they have small businesses, they can take their children to school, they can access healthcare. So that is for us is an element that enables us to qualify them as people who have graduated from this program.
Harriet Nyiradankize from the Democratic Republic of Congo is one of the beneficiaries who says she has gained tremendously from the project. She adds that she has spent over 14 years in Changwali refugee camp, and during these years she faced several challenges in providing for her family with life's necessities.
Endelea tu kukua pamoja nasi.
Life is better now because they're assisting us. Before this, we had no money, little food to eat, we had too many problems.
However, after the intervention of SMILES project, she was trained to engage in agriculture as a refugee and earn something for a living.
I have one garden that I cultivate, and I wish I could dig in 4 gardens so that we could have more to eat. I grow maize and tomatoes, which I sell. I also got vocational skills to make baskets and other items which we sell.
On top of that, she was trained in other different aspects such as business and saving, which she believes has changed her life.
Nilikuta kule kukoyo kazi ya mikono, walikuwa nafundisha wamama kushona vikapu.
So got vocational skills to make baskets and other items which we sell.
The project has not only benefited Harriet, but also other refugees testify the benefits of the project.
I got a lot of trainings from AVSI in business, because I know last time I was totally weak how to make business, and then because of the training of AVSI, and then I have to put that one in action.
In terms of education, the project has enabled them to have some income to take their children to school.
They were not going to school, they were staying at home. You find you have just a kid for just only a pencil. You find the parents said, "Are you just to sit? You stay at home." For us, we didn't study, but at least these days Children are going to school after.
According to area leaders, there has been a reduction in crime and domestic violence among the communities ever since the project started.
As I'm talking for now, there is a lot of changes. We are having a lot of thieves stealing our property here. Everything was even, but our community, man and wife in the house will find a lot of quarrel. They are quarreling, and when the smile enter in, all those things now they are no longer there.
Family looks to be settled now. Women planning together with their husbands, and then they are saving together, they are moving together for meetings. So it has also reduced on the level of the GBV in the society here, and this is really very grateful.
Meanwhile, after 2 years of training, over 7,000 households have graduated in both Changwali and Chaka refugee settlements in the first cohort. The projects are aimed at supporting 14,000 households in an area holding over 70,000 individuals.